Two throats, the airway and foodway. I think this is the most interesting curse I have ever heard in English. I'll knock your teeth down your throat. The imagery of knocking teeth down to the throat is terrifying. When we talk about the throat, we usually refer to two passages, one leading to the esophagus and the another to the trachea. The entrances of these two passages are called larynx and pharynx. The larynx is the entrance to the airway leading to the lung. The pharynx is the entrance for both food and air, leading to the esophagus, then gastrointestinal tract. The pharynx located near the mouth and nose, behind the mouth and nose, descends toward the back, while larynx, situated lower, houses the vocal cord and connects to the trachea in front of the esophagus. To remember this, think of la 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 singing with larynx, where the vocal cords are, indicating the airway. The airway is at the front. If you catch a cold and your throat hurts, the doctor might diagnose you with pharyngitis, which is inflammation of the pharynx. Laryngitis is the inflammation of the larynx, usually involving the vocal cords, causing hoarseness and barking cough. This condition is colloquially called croup, referring to a viral infection near the larynx. Since it's a viral infection, it typically resolves on its own over time. High humidity helps alleviate coughing, so you might take your child into steamy bathroom to soothe them, a practice known as using a croup tent. Below is a video of barking cough caused by croup.
Cough a few times deep, hard. No, cough. Here, cough. There you go. Again.
The epiglottis, the AIA valve, between the pharynx and the larynx is an automatic valve that directs food to the esophagus and air to the trachea. If this pathway gets confused, it can cause serious issues. This valve is the epiglottis, which sits between larynx and pharynx. The prefix epi means above and glottis refers to the tongue. As you can see in the picture, this structure is attached behind the tongue. Combined, they describe the flap-like structure that covers the airway during swallowing. The medical term for the tongue are lingua and glot. Lingua in Latin, glot in Greek. Normally, as shown in the video, the valve stays in the middle, allowing passage through both trachea and esophagus. When air enters, it opens the pathway to the larynx, and if anything other than air attempts to enter, it swiftly closes the laryngeal entrance. If even a small amount of non-air substance tries to enter the larynx, it triggers coughing to expel the foreign object, known as aspiration. However, if you rapidly consume air and solid substances simultaneously, like when you're drinking bubble tea, the epiglottis may not function properly. This can lead to tragic consequences, as illustrated by the following accident.
In China, a teenage boy died while drinking bubble tea. According to multiple local media reports, on the 26th, A, 16, who was drinking bubble tea on a street in Sichuan province around 10 a.m. on the 24th, collapsed on the ground. The hospital stated that the cause of A's death was suffocation due to bubble tea. It was determined that while A was drinking bubble tea, the tapioca pearls inside the drink went into his airway, blocking it and ultimately causing his death.
The epiglottis may not airway function as intended when faced with simultaneous intake of air and solids. Hence, the phrase, "it went down the wrong pipe," aptly describes the situation in English. It means that food or drink meant for esophagus, right pipe, has entered the trachea, the wrong pipe. Globus hystericus plumpit. The region surrounding the epiglottis is one of the most sensitive areas in human body, densely packed with sensory nerve. This allows it to detect even the smallest particles of dust and activate epiglottis to cover the entrance, to prevent them from entering the airways. The epiglottis can also distinguish between air and solid or liquid particles, making it a high sophisticated organ. However, this hypersensitivity can lead to various issues. Microinjury caused by acid reflux can be mistaken for foreign object, resulting in persistent coughing, which is the most common cause of chronic coughing. In some cases, even without specific lesion or foreign object, the throat may react excessively, causing coughing or discomfort due to foreign body sensation. Western medicine refers to this condition as globus hystericus, while traditional Chinese medicine calls it plumpit, maihechi. This condition has known by various names such as globus hystericus, globus pharyngeus, globus sensation, or lumps in the throat. Interestingly, it is a condition symptoms in both Eastern and Western society, and both have attributed it to psychological causes. Although the exact cause has not been clearly identified, several factors are thought to be contribute to this condition. These include increased visceral sensitivity of upper esophageal sphincter, acid reflux, and neurological abdominal sensation, neuropathic pain, and cough. Recurring back to the curse, I will knock your teeth down your throat. If the broken teeth go down the esophagus, they might pass through the digestive system, but if they enter the larynx while unconscious, it could lead to serious complication, even death. Take a message. Air and solid at the same time can be lethal.